Mouth pain is a widespread condition affecting millions globally, with prevalence rates varying depending on the underlying cause. Commonly, dental issues such as tooth decay affect between 60 to 90% of adults. Other types of dental problems include gum disease, where gingivitis impacts up to 50% of the population, and periodontitis around 10 to 15%. These are primary contributors to oral discomfort. Additionally, recurrent aphthous ulcers, or canker sores, affect about 20% of individuals, often triggered by stress, minor injuries, or certain foods. Oral infections like candidiasis, which is also known as oral thrush, are prevalent in individuals with weak immunity and have an occurrence rate of 70 to 90% among those individuals. There are also temporomandibular joint disorders, which cause jaw pain and headaches. They affect roughly 5 to 12% of adults, frequently associated with habits like teeth grinding. Viral infections, such as those caused by the herpes simplex virus leading to cold sores, impact nearly 67% of the global population, with recurrent outbreaks in about 20 to 40% of those infected. Serious conditions like oral cancer, though less common, account for approximately 3% of all cancers, with human papillomavirus significantly increasing the risk by 30-fold in infected individuals. And we are not done yet. There is also dry mouth, which affects up to 30% of the general population, often resulting as a side effect of some medications or chronic diseases, and significantly elevates the risk of tooth decay and gum disease. According to the World Health Organization, poor oral health is a major public health concern and has been linked to systemic conditions such as diabetes and heart disease. This is why in this video, we will reveal to you what could be causing your mouth pain and what to do about it. Now, without any further ado, let's get to it. Number 1. Canker sores. Canker sores are small, painful ulcers inside the mouth. They can appear on the inside of cheeks, lips, tongues, upper surface of the mouth and gums. Their appearance is triggered by stress, minor mouth injuries, acidic or spicy foods, and certain health conditions. These causes are believed to cause an abnormal immune response where the body's immune system mistakenly attacks the cells lining the mouth. The immune attack causes localized inflammation, leading to the formation of small, round, or oval ulcers. These ulcers are often white or yellow in the center with a red border. A study published in the Journal of Oral Pathology and Medicine in 2010 explored the cause of recurrent canker sores. The study involved 200 participants, including those with recurrent canker sores and a control group without them. Researchers collected data on dietary habits, stress levels, and family history of canker sores. After analyzing saliva samples, it was found that 60% of participants with canker sores had elevated levels of pro-inflammatory cytokines, compared to only 20% in the control group. These are chemical compounds that precipitate the inflammatory reaction. Adding to that, stress was identified as a significant trigger in 75% of cases. If you suffer from canker sores, you can treat them using over-the-counter topical medications, in addition to avoiding irritating foods, maintaining good oral hygiene, and using a soft toothbrush. Severe cases may require a prescription mouthwash or oral medications. Number 2. Tooth decay or abscess. There is no worse feeling than a sharp, throbbing pain in a specific tooth. To make matters worse, that tooth will probably be sensitive to hot or cold temperatures. These symptoms are an indication for the presence of a tooth decay or tooth abscess. Tooth decay occurs when the bacteria on your teeth starts to break the sugar in your mouth to acids. This acid then starts to erode your teeth, layer by layer. In 2019, researchers compiled data from 65 studies conducted worldwide between 1990 and 2015. They examined the correlation between sugar consumption, oral hygiene practices, and the prevalence of dental caries in different populations. They found that 80% of dental caries cases were linked to high sugar consumption and poor oral hygiene. You will need to pay your dentist a visit to treat such a condition. Depending on the severity and extent of your decay, Your dentist may propose fillings, root canal therapy, or tooth extraction. Over-the-counter pain relievers can help manage discomfort until you see a dentist. Number 3. Gum disease. Take a look in the mirror. Are your gums swollen, red, and receding? Do they bleed easily, for example, when you brush your teeth? Is your bad breath persistent and never goes away no matter what you do? If you ticked all the boxes, then you may be suffering from gum disease. Gum disease begins with plaque buildup along the gum line. If not removed, plaque hardens into tartar, which irritates the gums. This is known as gingivitis. If gingivitis is untreated, it can progress to periodontitis. This is when the inflammation spreads to the deeper tissues and bone that support the teeth. The gums may start to pull away from the teeth, forming pockets that become infected. To treat this condition, you need professional cleaning by a dentist or dental hygienist, improved oral hygiene, and possibly antibiotics or surgery in severe cases. In 2013, 1,200 adults were followed for 5 years and had their oral health assessed. It was revealed that those who practiced regular brushing and flossing had a 70% lower risk of developing periodontitis compared to those with poor oral hygiene. Number 4. Oral thrush. Oral thrush refers to the appearance of white patches on the tongue or inner cheeks along with pain, loss of taste, cracking at the corners of the mouth. This is due to the overgrowth of the fungus Candida, often due to a weakened immune system, diabetes, use of antibiotics, or inhaled corticosteroids. Treatment involves the usage of antifungal medications, maintaining good oral hygiene, and managing underlying health conditions. In 2017, a study was conducted where participants with oral thrush were randomly assigned to receive either an antifungal mouthwash, oral antifungal medication, or a placebo. 85% of patients treated with oral antifungal medication experienced complete resolution of symptoms, compared to 60% with the mouthwash and 15% with the placebo. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Temporomandibular joint disorders. Temporomandibular joint disorders feel as pain in the jaw, around the ear, or while chewing. The patient will also experience clicking or popping sounds when moving the jaw. The causes include injury to the jaw, arthritis, grinding teeth, or stress. A study published in the Journal of Oral Rehabilitation in 2015 investigated the prevalence and risk factors for temporomandibular joint disorders in a large population. Teeth grinding was identified as a significant risk factor, with 60% of disorder cases linked to this habit. It helps to rest the jaw and use a mouthguard at night. Physical therapy, stress management techniques have also been shown to help, and in some cases, surgical intervention may be required. Number 6. Herpes simplex virus. Herpes simplex virus is known to cause cold sores. These are fluid-filled blisters around the lips with pain, itching, burning sensation before blisters appear. They are usually triggered by stress, illness, or sun exposure. To deal with this condition, it is recommended to use antiviral medications, whether topical or oral, avoiding triggers, and using lip balm with sunblock to prevent flare-ups. A study published in the New England Journal of Medicine in 2009 evaluated the effectiveness of antiviral treatments in reducing the recurrence of cold sores. According to the results, participants taking the antiviral medication experienced a 50% reduction in the frequency of outbreaks compared to the placebo group. Number 7. Oral cancer. Symptoms of oral cancer include persistent sores that do not heal, lumps, red or white patches in the mouth, and difficulty swallowing. Factors that cause it include tobacco use, heavy alcohol consumption, human papillomavirus infection, and prolonged sun exposure to the lips. A study estimated that human papillomavirus positive individuals had a 30 times higher risk of developing oral cancer compared to human papillomavirus negative individuals. When it comes to oral cancer, early detection is critical. Treatment typically involves surgery, radiation therapy, chemotherapy, or a combination of these. Number 8. Dry mouth. Dehydration, certain medications, radiation therapy, or conditions like Sjogren's syndrome can all lead to dry mouth. Dry mouth occurs when the salivary glands don't produce enough saliva. The reduced lubrication in the mouth leads to a dry, sticky feeling, difficulty swallowing, and a higher likelihood of oral sores and infections. Moreover, the absence of saliva can also lead to bad breath and altered taste. Drinking more water, sucking on sugar-free candies, and using saliva substitutes can help combat that dry and sticky feeling due to dry mouth. So these were the top causes for your mouth pain and what to do about each. Now we want to hear from you. Have any of the conditions we described ever caused you mouth pain? How did you deal with it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.